You have probably seen someone with a very white crown on an anterior tooth and immediately noticed, even without any dental training, that the tooth was not natural. Interestingly, the problem is often not that the crown has been poorly fabricated, but rather that a natural tooth is not simply a white object. It is important to understand that the human eye does not evaluate tooth hue alone. It simultaneously perceives value, chroma, translucency, surface texture, gloss, fluorescence, and the way light interacts with and travels through the tooth. This is precisely why a crown may have almost the same basic color as the adjacent natural tooth and yet still resemble a piece of porcelain. A natural tooth is an optically highly complex structure. Enamel is partially translucent and allows light to penetrate into the deeper tissues, whereas the underlying dentin has a more pronounced intrinsic color and contributes substantially to the final appearance of the tooth. Some incident light is reflected from the surface, while another portion penetrates the enamel, undergoes scattering within the dental tissues, and is subsequently returned to the observer. Consequently, a natural tooth possesses optical depth that cannot be adequately reproduced simply by selecting a single white shade. More importantly, a tooth does not exhibit a uniform color from the cervical region to the incisal edge. The cervical third is generally more chromatic because the enamel is thinner in this region, and the optical influence of dentin is therefore more pronounced. The middle third has its own optical characteristics, whereas the incisal third may be considerably more translucent and may display bluish, grayish, whitish, or orange optical effects. If a crown is fabricated with a completely uniform appearance from the gingival margin to the incisal edge, the human visual system rapidly recognizes that something is unnatural. One of the most common reasons for an artificial appearance is excessive value. In dental color science, value refers to the relative lightness or brightness of a tooth or restoration. A crown may belong to approximately the correct hue family, but if its value is too high, it appears to stand out from the surrounding dentition. The patient will often describe this simply as too white, although the actual problem may not be the hue itself, but rather the amount of light reflected by the restoration toward the observer. Another major factor is translucency. A natural tooth is neither completely transparent nor completely opaque. If a crown is excessively opaque, light remains predominantly at the surface, causing the restoration to appear flat, chalky, and lifeless. Interestingly, even naturally very white teeth may retain a considerable degree of translucency. Therefore, whiteness itself does not necessarily create an artificial appearance. Rather, the artificial effect arises when high lightness is not accompanied by the optical properties characteristic of natural dental tissues. Conversely, if the ceramic is excessively translucent, the color of the prepared tooth, core buildup, or other underlying structures may become visible through the restoration. The final result may then appear grayish, darker, or entirely different from what was originally intended. For this reason, the color of the underlying tooth structure is critically important. A crown is not an isolated white cap, but rather part of an integrated optical system involving the residual tooth structure, the ceramic material, ceramic thickness, and the luting agent used to cement or bond the restoration. Even variations in ceramic thickness can alter the color and translucency of the definitive restoration. Consequently, inadequate or non-uniform tooth preparation may create an aesthetic problem that is difficult to correct later merely by selecting a different ceramic shade. Another optical property of natural teeth that patients rarely mention, but that the human visual system readily perceives, is opalescence. Natural enamel may exhibit bluish effects in reflected light, while producing warmer orange-red hues in transmitted light. If a restoration does not reproduce a comparable interaction with light, it may appear more monotonous than the adjacent natural tooth. A similar principle applies to fluorescence. Natural dentin exhibits fluorescence, meaning that it can emit visible light when exposed to radiation of specific wavelengths. Contemporary dental ceramics may therefore incorporate fluorescent components designed to reproduce this phenomenon and provide the restoration with a more natural appearance and greater optical vitality. The tooth surface is equally important. Natural enamel exhibits subtle surface texture, including fine depressions, elevations, developmental features, and a characteristic degree of gloss. If a crown is perfectly smooth and excessively polished, it may reflect light differently from the adjacent tooth. Conversely, if its surface is excessively rough, its optical behavior will again differ. An exceptional dental technician, therefore, does not merely reproduce tooth color. They also attempt to recreate the surface morphology and texture of natural enamel. There is another phenomenon that can be particularly confusing for patients. A crown may appear perfectly matched in the dental office, but suddenly look different at home. One possible explanation is metamerism. Two objects may appear very similar under one light source, but noticeably different under another. A crown may therefore match the adjacent natural tooth extremely well under a particular illumination, while the discrepancy becomes more apparent under daylight, fluorescent lighting, or warm artificial illumination. For all these reasons, shade selection for a crown is not simply a matter of identifying a single matching tab on a dental shade guide. The natural tooth should be analyzed in different regions, with careful assessment of its value, chroma, hue, translucency, and individual optical characteristics. This information must then be communicated accurately to the dental technician. Clinical photography can be particularly valuable because it conveys visual information that a simple shade designation can never fully communicate. Perhaps the greatest mistake is to assume that the whitest crown will automatically be the most aesthetically pleasing. In reality, it is precisely the subtle irregularities, color transitions, variations in translucency, and complex patterns of light transmission and reflection that give a natural tooth its vitality. When these characteristics are eliminated and replaced by a perfectly homogeneous, highly luminous, and completely opaque surface, the result may be a technically well-fabricated crown that nevertheless looks unmistakably artificial. The best crown, therefore, is not the one you notice first when a person smiles. The best crown is the one you do not notice at all. It does not necessarily have to be the brightest restoration. Rather, it must interact with light in a manner that closely resembles the surrounding natural dentition. Only when hue, value, chroma, translucency, fluorescence, opalescence, surface texture, and material thickness are harmonized does dental ceramics cease to look like porcelain and begin to resemble a natural tooth.
Vai.
Nossa senhora!
Não, mas a maioria foi nessa, a outra só usou as casinhas no
Fazer isso aí, parabéns, meninas. Tá bem?
Faz assim, cara.
Pronto, minha boca está abusada já.